Tonight, we honor the heart of the healthcare community. To help recognize outstanding nurses across the region, we asked a distinguished selection committee comprised of respected leaders from such organizations as Johns Hopkins University, the Mayo Clinic, the University of Missouri, and the Nurse Practitioner Healthcare Foundation to review the candidates. In all, they scored more than 200 nominations and helped select 57 finalists across 19 categories. These nurses represent a vast range of practice areas and levels of expertise, from emerging leaders to those with a lifetime of experience. They serve as inspiring examples, balancing an often difficult, technically demanding job with grace and compassion. Somehow, they make the life-changing look routine. For that, we say thank you.
Nursing is a very important role. It's the person that patient sees every day in the hospital. It's that person that they feel comfortable talking to. Maybe they are not able to tell the physician some things that they're able to talk to the nurse about.
Michelle has touched the lives of a lot of our patients here at both Barnes West County and at WashU. She's a determined patient advocate. So there's times where patients come in with a diagnosis been provided to them already. They're here for their neck or they're here for their back, and it turns out that's not the problem they have.
So working in the ICU, when I had that experience as a nurse, kind of brought a lot of things together as far as caring for the patient, understanding processes and how things work. Now that I'm more specialized in neurosurgery, I'm able to take that information and use it in my job every day.
Michelle's had a tremendous impact on our organization. We've been steadily moving out to Barnes West County. We don't have residents or fellows out here typically at Barnes West County. And so she's really stepped into that role of helping us as a mid-level practitioner to provide patient care here, both in the hospital and in the clinics.
I never have any doubts about the course I've taken. It's led me to where I'm at now. I work with a great physician. Dr. Wright's been amazing to work with. I'm able to kind of guide where I want to be and choose what path I want to go in my role. And I absolutely enjoy getting to know the patients on the inpatient side and the hospital side, and then the OR will be the next challenge for me, and I'm very excited to do that. It'll tie everything together for me.
Started off in my childhood. My father served in the military for many years, and my mother was a nurse, so we have a lot of nurses in our family. And the idea of serving others and giving something back was kind of sparked in my heart at a very young age, and so got into EMS first, became a paramedic, and eventually just thought, well, nursing seems like the natural way to progress. I loved taking care of patients and families in those most critical moments, and then fast forwarding, I went on to be a nurse educator.
One of the things that makes the ED fellowship so unique and amazing is he not only teaches them the technical aspect of their job, but he teaches them the human aspect. And that makes it different. I work with the fellowships, the general fellowship, nursing fellowship. I work with the ICU fellowship, and his is different because of that aspect. He really, every day, hits that home.
Most of the nurses I work with are coming straight from academia. Some are nurses that come from non-critical care areas here at Mercy, but the sky is the limit for them. You know, nursing is a very noble profession, and one of the things I try to challenge them with is really strive to find out who you are as a nurse. I mean, everybody has a piece that they can contribute to this profession that ultimately impacts the quality of care that we deliver to our patients on a daily basis.
When I was 7, I was hospitalized. And I had the privilege of being cared for by some really, really good nurses. And that was one of the guiding forces for me to become a nurse. But even more significantly than that was because of my mom. I thank my mom for inspiring me to become the nurse that I am, because I've really had an incredible career, and I really owe that to my mom.
Diane is the best chief nursing officer I have ever worked with in my 35-year career. And she has a lot of attributes that bring me to say that, but at the core, it's the compassion, and it really is servant leadership. She cares so much about the patient. She also cares very much about the team members. And we have a philosophy that we need to take care of one another if we expect our team members to take great care of our community.
First and foremost, I am a nurse. And being the Vice President of Patient Services and the Chief Nursing Officer, I keep that in the forefront of my mind every day. As I make decisions, I make sure that I stop and think about our patients. Is this the right decision for our patients? Is this the best care that we can provide and the process that we can put in place to provide that high quality care and the best patient experience?
We are very blessed to have Diane. She has very long tenure here at St. Luke's, which really enriches the fabric of our organization. I'm a believer, as is Diane, in lifelong learning, and I see that every day in Diane. She does not settle for mediocrity, and all of that leads us to having incredible team members, incredible nurses, delivering with the entire team at St. Luke's great care.
I got into nursing because I'm passionate about the profession and I want to make a difference in the lives of patients, and in so doing, I want to be directly involved in their care. I'm a clinical instructor adjunct, so I bring the students here at Barnes Jewish Hospital and do bedside clinicals.
Julia is clinically superior. She understands her patients and their needs, and they go way beyond medical sometimes. Her students also benefit from the same type of thing. They're like little birds getting ready to be pushed out of the nest, and Julia is the mother, and she wants to make sure that they're gonna fly and they're gonna soar.
What I bring to my students is I want them to love what they do and to do nursing from their heart.
Julia is so deserving of this award because she spends her entire time here giving. She gives to the patients, their families, the staff, the doctors, and it doesn't even occur to her that there would be any other way.
I come to work, I'm just a little part of the picture. And a part of the bigger picture is Barnes Jewish Hospital making a difference one patient at a time. And I try to dedicate myself and respect every patient that I come in contact with. So knowing that, it's just a joy coming to work.
The best thing I like about being a nurse manager is being a mentor and a coach.
Sarah taught me to be compassionate. She is the most compassionate person I've ever met. She comes in, does her job with a smile on her face. She never has anything negative to say, and she's just a true leader that I have always wanted to follow and a role model that I have looked up to since I've started here.
And advice that I could give a new nurse is that you want to treat the patient that's sitting in the bed as if they were your own loved one.
Every day, Sarah has impacts on patients. She goes in and rounds on them daily and asks them how their stay has been. And whether it's for 5 minutes or an hour, she never rushes out of the room. She lets the patient talk to her and gives them the time that each patient feels like they need.
It's an amazing feeling. On our floor, you're walking in the hallway and you're saying, "Oh, Mr. Smith, you're doing great, look at you go." Every nurse on the floor does that. I think it does help, and it makes you feel good.
I work with families that have been diagnosed with some sort of fetal anomaly, whether that be from their primary OB or a high-risk OB. They come here. We see a whole range of diagnoses, things from mild to severe. And even if it is mild to a family, it's not necessarily mild. It's the loss of a normal pregnancy. So what we do from there, they come here, we help confirm the diagnosis, whether that be to do an ultrasound, an echo, an MRI, depending on what organ system is involved. And then once we figure that out, we help educate families about what that diagnosis means.
Kate's an amazing nurse. Not only is she crazy smart, but she is compassionate, she's non-judgmental, and she's never met a person that she can't get along with.
Everybody always says they want a job where they can make a difference and influence others, and nursing, you actually get to do that. I love being wrong medically, where we think we can tell a family, this is gonna be the outcome, this is gonna be the prognosis. Very poor prognosis a lot of times is unfortunately what we have to tell families. And when they can come back and tell us, you were wrong, walk back in with their kiddo who's doing well, who was discharged from the NICU, who's meeting milestones and developing appropriately, it's so rewarding.
I'm an assistant professor here at the School of Nursing, and I teach and coordinate the public health nursing course for our traditional undergraduate students.
Ever since I've met her, she's just very dedicated and passionate about helping students and educating them and empowering them about health promotion, especially of underserved populations and of patients with heart disease.
It's rewarding for me because I get to work with students, teach, I get to mentor. I also get to do research with heart disease, which is an area I'm really interested in. And I also get to provide service to my community. And all of that is within my job description. So I really find that nursing is a very rewarding career for many of those reasons.
When I started as a new grad in the neonatal intensive care unit, I was struggling with going from being a new grad to a practicing nurse. And the leadership in the department was so amazing in supporting me that that's when I realized I wanted to be a nurse leader.
Kelly really has this unique talent where she is able to connect with people. She can connect with leaders, nurses across the organization, as well as outside of nursing. And that really makes her very successful at her role because she can help each of us understand. She looks at each of us from different perspectives and different experiences to then achieve a common goal.
So an advice I would give to a new nurse is to not set yourself so early in what you are going to be when you, quote, grow up. Nursing is changing and is evolving. So I would say get involved, try new things that you may not be sure of, because that's going to really show you all the opportunities that are out there.
When I started my career, I started as a surgical technologist, and then, I wanted to become more. I wanted to make a difference. I wanted to impact more, the care of the patient. And so I went into nursing, with the hope that I would be that person that makes the difference.
Martin, he's manager for the neurosurgery service, where his staff really have to be very knowledgeable, technically skilled. They have to be able to work with really high-tech equipment. They have to be able to work in a very stressful environment with critical patients. They get stressed, they get tired, they need help, they need encouragement, they need to feel that somebody cares about them. That's what he does.
Actually, leadership chose me as I moved along, and it started with neurosurgery. We always say, you either, basically neurosurgery either picks you or you pick neurosurgery. It picked me, and naturally it led into leadership. And it all began, here at Barnes Jewish Hospital, where, I wanted to be a part of the team because of what we're known for. We are known for excellence in care. We're known for, doing high-level acuity patients. And I wanted to be a part of that team and help drive that team to where we get better outcome and better goals for the patients.
He's so interested and so excited about being an excellent nurse and an excellent mentor to his staff. I look at him and I'm inspired by him. I want to be like him. He's just he's just an inspiring kind of person.
The reason I became a nurse was my grandmother was a nurse and she was my inspiration. But really it was because I wanted to make a difference in people's lives, and I knew that nursing was something that I could go and be a leader to help improve patient outcomes.
Maggie is a terrific leader. She empowers everybody that works with her to give their input. She helps guide them.
I'm currently in my DNP program on leadership. People have asked, why are you going back to school? If you're towards the end of your career, why are you going back to school now? And part of it was because as a leader, I want to be able to make that difference. And as a leader, I can ensure, are we doing evidence-based care to really promote the best outcomes that we can have for our patients? My advice for new nurses is this is an absolutely wonderful area to work. I've been here for 32 years, but I also tell nurses they need to follow their passion. Don't just think this is the area. Follow what you're really drawn to, because if you're passionate, you're going to make that difference that you need to make.